Good afternoon. The Senate Finance Committee is in session, and we're dealing with voting list number 27. Okay, which one of the analysts is going first? Okay, Nathan.
First bill on the list is House Bill 696, which with two very minor technical changes that I'll describe is identical to provisions of Senate Bill 528 related to electric school bus pilot programs. Senate Bill 528 passed the Senate earlier this session. So House Bill 696 establishes the electric school bus pilot program implemented and administered by PSC. An investor-owned electric company may apply to the PSC to implement a pilot program as specified. The two very minor changes are, in one instance, to change the word exceeds to exceed, and in another, change the word electronic to electric. So no substantive changes.
Okay. Senator Kramer.
Yes, Madam Chair, I would like to move favorable on that bill. The bill has been put in the exact same posture, if I am correct, as the language that was in the Climate Solutions Act. And colleagues, I would like to bring to your attention a document that I received less than 5 minutes ago that indicates that the Prince George's County Board of Education recommended that they support the bill. So I know there was a lot of commentary over that over the last few weeks, and I just wanted to share that with the committee.
Thank you. Senator Hershey.
Yeah, thank you, Madam Chair. To follow up what my colleague just says, isn't this already in the Climate Solutions Bill? Why do we need a standalone bill for this? Maybe you know?
I didn't know you were asking me. Is that directed to me?
I was asking anybody. I mean,
Oh.
you're supporting it. Why? If it's in the
I
cli-
think it's no different than when we have House and Senate bills that are cross-filed. We have a Senate bill that now contains this language, and we would simply be sending back a House bill that has the identical language. And there's certainly no harm and no foul in doing so. And I think the House bill sponsor deserves to have this bill passed out with all the time, work, and effort that the sponsor has put into the legislation.
I like the sponsor too. I don't know if we have to give awards for hard work.
Not a question of an award.
Okay.
That's what it sounded like.
Senator.
I'll second Senator Kramer.
All right, so we've got a motion and a second. Any discussion on the motion? Yes.
Still think that this needs to be discussed, just because, you know, this language was shoved into a omnibus climate solutions bill doesn't mean that we've discussed the policy around this. It just means that the House has agreed to the policy. You know, we've had a cross-file over here for many years that we've decided not to move forward with because of the cost of this bill. It's $50 million per utility service area. You know, if you have four major electric utility companies, that's $200 million in costs that are going to go to buy school buses and have all the other ratepayers within that service territory pay for this. This hasn't been vetted out. I mean, this hasn't been discussed to what we really understand this is bill's about. We've heard cries of, you know, kids breathing in diesel fumes, and because we've heard that, we think that we have to pass a $200 million pilot program. It's not, there's nothing that's been proven about it. There's no school system that's come in that says that they definitely need to do this. You know, this is just, again, above and beyond the $200 million. This also talks about the infrastructure programs, the facilities that are in place, all of the interconnection that's necessary to put these in place. Also, the benefit is that when school buses aren't in service, the utility companies can pull electrons out of the stored batteries. I asked the question on the bill hearing, how many houses does a school bus power up? I mean, is it 2, 3? What's the answer to that? Yet we're going through with a $200 million pilot program? It's absurd.
Good set of rhetorical questions. Senator Bottle.
It's a statement that all of a sudden
All right, Senator Bo-
comment that because he jumped on the light first and says, I'm moving favorable about it, that all of a sudden we're not allowed to discuss these bills anymore? I mean,
Well,
this,
we are discussing, but we want to hear from everybody. All right,
Madam
Senator
Chair,
Bottle.
thank you for calling on me. I don't recall in the climate bill, which was changed pretty dramatically when it came back from the House, if it specifically called out that Prince George's County could have a pilot, or was it just in general about pilot programs? So that's my first question. Yes, it was,
Any jurisdiction can participate if they choose to do so.
okay.
And, yes, that is correct.
So this is Prince George's with the support of the Prince George's delegation, this particular bill.
Question had been, would the Prince George's Board of Education be supportive of the issue?
Okay,
And what I received just now is a memorandum with the Prince George's County Board of Education title on the top of it, indicating that the board took this up under consideration, and it says that after discussion, the committee voted to recommend that the Board of Education support these bills. The recommendations have been forwarded.
okay.
And so, and I think actually I've got a final
All right.
copy.
Thank you for that
Okay,
answer. I
Senator
appreciate
Reedy.
it. And I am concerned about the fumes from school buses. I really am, and our kids are not, they're riding on them, they're standing behind them, you know, they're waiting on parking lots to get on the buses, so I do think the fumes are a big deal, and I appreciate this bill. Thank you.
All right, his is off. All right, I guess then Senator Klossmeyer.
Well, actually, no.
Oh, you had turned it back off when I.
Well, no, I think it got turned off because Senator Biden wasn't finished, which was okay. Of course. I just was curious, does the Prince George's County School Board have taxing authority? Because there's a cost associated with this, so, I don't think any school board in the state has taxing authority. So I'm sure under duress, because they were told, do you support something good for the environment or bad for the environment, a local board, in a county probably is like, oh, we're for something good for the environment. But that doesn't, to me, mean anything. I mean, relative to the discussion here, I think it's a policy question, and I think Senator Hershey's points are excellent about why this should be a more robust policy discussion, as opposed to just sort of hastily done here at the end.
I would say there are many environmental reasons why it would be helpful, and maybe they are looking for a model or a pilot. Senator Klossmeyer.
Yeah, now, this is in that bill, the big bill. And I guess my question is, now, Prince George's County said, yes, you know, we would like that pilot, but suppose nobody does the pilot, what happens then in that omnibus bill? Does
And
any,
none of the $200 million we just heard railed about will be utilized, and nobody will have spent a penny to do anything. That's the answer.
oh, well, thank you for that answer.
Okay. Senator Feldman.
So I agree, Senator Hershey raises good issues, and this is a policy call. I agree with Senator Reedy. The problem is, you know, we did have a lengthy debate on climate solutions in the Senate, and, well, but there was opportunities to amend, to raise this issue within that bill, to take this provision out of that bill. I'm just saying that we voted on that bill, and so some of the arguments, you know, would have been appropriate to bring up at that time. Not that they can't be brought up again here, but that bill's already in front of the governor. And so this, you know, discussion that Senator Kramer's making is having weighed in and voted out of the Senate, including every member of the committee had an opportunity to raise this particular issue. All we're doing is passing a House bill that mirrors that. So, you know, that may not be a compelling argument, but it is the reality of the situation, any way you cut it.
Senator Hershey.
if I could respond to that, this committee did not have the opportunity to take that language out of the climate solutions bill. The only one that could have done that was EHE, because they agreed to concur with the House's amendment. So we didn't have that opportunity. Certainly, we had the ability to argue about it on the floor, and you heard that. And that's why my colleague is bringing up this Prince George's County letter. I don't understand why does Prince George's County matter in this conversation? I know exactly why it matters, but I don't know why it matters to the debate on the policy issue. It matters for one reason, is because Representative from Prince George's County opposed the bill on the floor, or questioned it at least. So it still goes back to the policy issue. This part of the bill was shoved into the Climate Solutions Bill by the House because they wanted the bill. This committee that has jurisdiction and understands what this bill really does has not weighed in on it before. Well, we've weighed in on it before because we have not passed the bill for the last 3 or 4 years that it's been before us. It is hugely expensive, okay? If we are concerned about kids, breathing exhaust fumes or diesel fumes, then every school board has the ability to do whatever they want for it. But my question is, should every utility rate bill payer pay for that throughout the entire service territory? So if Anne Arundel County decides to do it, and they're the only ones, well, in that service territory, Baltimore County's paying for it, Baltimore City's paying for it, Howard County's paying for it. All of the ratepayers are going to pay for that. If Anne Arundel County wants to do it, they think that's a big deal, then let them do it themselves.
Okay.
But why are we passing this cost on? Madam Chair, one last thing. We have decided that we can't tax people enough anymore. Nobody wants to pass bills that tax people. So now what we're doing is we're doing all of these different policy initiatives through people's electric bills. That's become the new way that state of Maryland has decided to tax people. We come up with some policy idea, and we say, you know what, we're going to sneak it in their utility bills, and it's $1.50 a month, or $2 a month, or $5 a month. We don't care about it anymore because it's the utility bill. It doesn't look like a tax. People won't care. The utility bills are going up all the time. That's the new way that Maryland has decided to tax people. When it comes to all of these environmental type issues, we're doing it through the utility bills. This is another example of a $200 million pilot program that's going to be borne by utility rate holders. This isn't people that send their kids to school. It's not that. Utility rate holders are going to have this cost buried in their utility bills, and we're okay with that. Because, again, they can't see it. There's no transparency anymore.
All right, let me make one quick comment, and I'm going to Senator Kramer. I do think whether you're for it or you're not, and we'll know in a minute, and so we can move on to other bills, that all of the people of the world, including those of us who live in tiny Maryland, will benefit, though it might seem like a minuscule amount, if we can move from modalities that create additional climate change problems to those that would begin, even if in a minuscule way, to take us in a direction that would make there be a better environment and more livable air and a climate that's more usable for our children and grandchildren or for future generations. That's all I have to say about it. Now, Senator Kramer, and then we'll decide if you're for it or you're against it, so we can move on and do these other bills.
And thank you for that, Madam Chair, and I appreciate your comments just now. And at the heart of this legislation is that very issue. For those of us who are concerned about the climate crisis, who are concerned about the fact that we now, technology that didn't exist previously demonstrates that diesel exhaust fumes are in fact a carcinogen with no safe level of consumption, that they are destroying our atmosphere, and that we now, if we're concerned about the climate crisis and the impact that it is having on our environment and the health of our residents, those of us who want to address it are making that statement and taking action by voting in support of this bill. For those who are still denying the climate crisis and would prefer that we remain dependent on fossil fuels, that's their business. And it's not my policy decision. So, but my policy is my commitment to address the climate crisis, Madam Chair.
Okay, Senator Hirsch, and then I hope somebody will make a motion.
What I
to
don't
do
understand is
something.
if it's so important, Senator, that this needs to be done, why can't the school system just do it on their own?
That's an excellent question, and that is why this bill is so clever. The bill sponsor
It is
came
clever.
up.
You're right.
The bill sponsor came up with a unique way to help all those low-income jurisdictions, and perhaps, and I doubt that you speak for your Board of
No, my-
Education, but it will afford your Board of Education, if they do not have the financial resources to participate in electrifying their school buses, and try and see what might happen through this pilot program. This is for our lower income
I understand.
jurisdictions. No.
I
We
understand
asked
now.
the
Right,
question.
right. You haven't answered
And
it.
in I've totally answered
yeah.
it. In Montgomery County, we've decided we want this. And so, yes, we are dedicating, and because we are in a position that we feel it's a viable investment in the future
So Montgomery
of
County's not
our
gonna participate in
environment
this?
and the future of the health of our children.
I know.
We're doing it. But
So
not
Mon-
all jurisdictions are in a position
All
to
right,
take
so,
advantage
Madam
of
Chair, my
that.
final question. So Montgomery County's not going to participate in this?
We have no clue. I asked
Oh,
my
I thought you said-
county.
I thought you said they were
asked
doing it
my
already.
county, and they indicated that the way the bill is worded, we don't know whether Montgomery County would be able to or not. And the reason is Montgomery County is contracting out these services.
Which most
They're
counties do.
not buying
Right.
the buses.
That's what most
So,
counties do.
the fact that I am supporting this legislation, I am doing so without any understanding whatsoever as to whether Montgomery County may be able to participate or not. We're moving in that direction regardless. This is in support of those jurisdictions that do not have the resources to be able to participate.
No. Okay.
That's
So
what
we-
this bill is
We
about.
found a
I think
unique
a
way.
lot of good questions, colleagues, have been asked and answered. We may or may not like the questions or the answers, but we've got to move to the other bills. So we've got a motion before us that has a second. Let's call the roll.
House Bill 696, favorable. Senator Feldman? Aye. Senator Klausmeier? Yes. Senator Benson? Yes. Senator Kramer? Yes. Senator Hayes? Yes. Senator Reedy? No. Senator Augustine? Yes. Senator Beidle? Yes. Senator Hershey? No. Senator Jennings?
Just to clear up one point, diesel fuel, in 2010, EPA required all these diesel
But
engines.
right now, we're really.
Well, I'm explaining my
just-
vote, with all due respect, Madam Chair, that they have to have DEF, diesel exhaust fuel, or fluid added, so you don't have those smoke plumes that you have anymore. With that, I'm voting no.
Madam Chair?
Yes,
Yes.
okay. Thank you. We're going next to House Bill 794.
House Bill 794 establishes an opioid restitution fund advisory council. The opioid Operational Command Center, or OOCC, must staff the advisory council, and the advisory council must report by November 1 each year on its findings and recommendations regarding the allocation of money from the opioid restitution fund, consistent with authorized uses of the fund and considering specified criteria. The purposes for which the fund may be used are expanded, and the expansion of the ORF uses can be found on page 6 of 8 of the reprint. The governor is required to consult at least twice annually with the advisory council rather than at least once annually with specified stakeholders under current law to identify recommended appropriations from the fund. There are some amendments that add representatives to the advisory council. The provision from, Senator Reedy is to add one individual designated by the executive director of the Maryland Municipal League, and the chair is offering an additional amendment to add the Attorney General's designee.
Okay, Senator Reedy?
Yeah, thank you. I represent a bunch of towns, and talked with MML folks a lot about different issues. This actually came up even during the interim about concerns about making sure the towns, I say the towns, I mean, we got Baltimore City and Frederick. We also have towns like, Westminster that are medium-sized and really small towns. And just to have one person that sort of represents MML's interest on that would be, would be great. So I don't know if I need to move the amendment or we're going to take it, but that's why I wanted to get the amendment drafted.
Let's move the amendment. Second.
Okay, we got a motion and a second. Senator Bottle?
Didn't we pass a Senate bill for the opioid restoration fund? This is different because it's
Yes.
just the advisory council?
Yeah, just not to get too into the weeds, but we did pass, and I was sponsored a broader bill that set up the infrastructure to distribute money. And, there was a big July last year, big settlement. And then in January of this year, the Attorney General came to an agreement with 58 of our 60 subdivisions, and municipalities, in terms of a distribution amongst, it was a January agreement. So, and we have another bill that wanted to get into the opioid restitution fund and deviate. We had actually even an amendment on the floor that we resisted. I did run this specifically by the Attorney General. The other issues and amendments they had a problem with, said that it would be problematic within the broader settlement. They advised us that this one they were okay with. And so I'm just going to go and defer to the Attorney General, who's the one who put together the local deal and came up with the $400 million global settlement for Maryland at the national level. And so they're okay with it. It's basically all I have to, if there was a problem, I would say resist this bill, but they say they're okay with it.
So the Senate bill's not going to pass in the House, it's this
No,
bill.
this is unrelated to that was a broader bill. There was a House bill and Senate bill. Those
Okay.
bills, I believe,
Okay.
have passed both chambers. This is something completely separate, creating this
Okay.
advisory council. This has nothing to do with those
Just
bigger
all
bills.
kind of running together.
Yeah, it's
Thank you.
confusing, I admit it.
Okay, so we have a motion and a second. Is that right?
On amendment, we had
On- amendment, okay.
MML amendment, I think it was.
All right.
And the Attorney General amendment. How about those
Okay.
two put together into one vote? or-
Could we consider voting once, including the MML amendment?
And the Attorney General. It's including them
right.
on this council.
All right, Tammy, could you call the roll?
Senator Feldman.
Aye.
Aye. Senator Klausmeyer. Yes. Senator Benson. Yes. Senator Kramer. Yes. Senator Hayes. Yes. Senator Reedy. Yes. Senator Augustine. Yes. Senator Bidle. Yes. Senator Hershey. Yes. Senator Jennings. Yes. Madam Chair.
Yes.
Yes.
All right, that's unanimous.
So we got to move the bill as amended now.
All right, now we'll move the bill as amended.
Second.
All right, all in favor of that motion, raise your hand. Okay, that's unanimous. Okay.
House Bill 970 relates to the coverage of HIV post-exposure prophylaxis, or PEP. So you may recall that the committee was second on a bill that had some coverage requirements relating to these two types of HIV prevention drugs, pre-exposure prophylaxis and post-exposure prophylaxis. Senator Lamb had a more comprehensive bill that also had some provisions relating to health occupations. So that was passed out of the Senate, but I think it's stuck in the House. This is a part of that bill. It's narrower in focus. And we did have a Senate bill that Senator Feldman had introduced that's a cross-file to this, but we're holding on to it because it was duplicative of what was in that broader bill. So this is the House bill, the narrower bill, and what this does is it prohibits an insurer, a nonprofit health service plan, HMO, as well as a Medicaid managed care organization from applying a prior authorization requirement for a prescription drug used as post-exposure prophylaxis for the prevention of HIV if the prescription drug is prescribed for use in accordance with the U.S. CDC guidelines. There was no opposition to the bill, and I think that's the status.
All right, Senator Feldman?
Yeah, just again, refresh, I had a bill, we held it because there was this broader bill that incorporated it, but since that's running into trouble, that's why this is back up. Just again, bottom line is, by getting rid of the prior authorization, this particular drug is only good if it's used within the first 72 hours. So if you wait longer, it becomes less effective. So the whole prior authorization thing is highly problematic. And so just in a nutshell, this is important from an HIV prevention, and particularly when we're dealing with alleged rapes, sexual assault, this really comes into play. So that's kind of just to refresh everybody's memory, because it was a while back when we had the standalone Senate bill, which is now we're bringing back. So I'll move favorable. We'll just move the House bill. We've got the Senate bill here, but we don't need to, I don't think we need to deal with that.
Okay, so we got a motion. Do we have a second? Second. All right, motion and a second. Any further discussion on the motion? If not, are you ready for the question? All right, all in favor, raise your hand. Let's see how that'll work. All right, that's unanimous. Thank you.
House Bill 1127 was one that the committee considered yesterday. Senator Reedy had asked to hold the bill for a day. This is the bill that requires the state-designated health information exchange to operate as a health data utility for the state, provide data to individuals and organizations involved in the treatment and care coordination of patients, and to support public health goals. And requires prescribers to submit certain prescription drug data to the Health Information Exchange.
Senator Bida?
I'd like to ask to hold this bill. I have
All
some
right.
questions.
She's
Thank you.
asking to hold it. Okay. All right, we'll hold it a day. Yeah. Okay.
House Bill 1433 requires the State Highway Administration to designate Maryland Route 210 as Piscataway Highway. Just to flag for the committee, there was a letter that was submitted by the tribal chair of the Piscataway-Conaway tribe that raised some concerns about the bill.
Yes. In fact, they were kind of insulted by the bill. So in light of that, we're not trying to, even though I'm sure the sponsor had good intentions, if the people that you think you're honoring feel insulted by the product that you've worked on, we probably don't want to ever send this to the floor or try to move it.
Then why is it on the voting list?
Well, because the bill was before us and we heard it.
We've got a collection of those in your drawer right now, Madam Chair.
Well, we don't know about that.
Okay, did somebody ask for,
Whole collection of
did
those.
somebody ask for a hold, or what do we?
No, let's vote it down.
In all respect to the sponsor, let's hold it, and if he wants to reach out to the people and see if he can get it.
All right,
Fix it.
we'll
Let's
hold it.
Hold.
I think the sponsor's aware by now, though, that they're upset, but if they'd gotten out of the house before, he was aware.
Got one hold to figure it out.
Okay,
Okay, moving down the list, House Bill 1026 was heard late last week. It increases the membership of the existing two-generation Family Economic Security Commission by adding a member appointed by the Secretary of Human Services who lived in and experienced poverty in Maryland and who was, within 3 years prior to the appointment to the commission, a recipient of public assistance. The House amended out the requirement that those folks get reimbursed for attending these meetings, so it just adds this person to this existing two-generation Family Economic Security Commission. There's no amendments.
okay. Is there a second? Okay, it's been moved and seconded. Any discussion on the motion? Not if you're ready for the question. Yes, Senator Hayes?
Voting for it.
Okay. All right, all in favor, raise your hand. Are you, okay, that's unanimous, thank you.
The next bill is House Bill 1188. If you recall, this committee passed a bill that established a sickle cell disease registry that went over to the House. The House had actually about 4 or 5 bills dealing with this topic. They combined them all into one bill and simplified things. And this bill in front of you requires the Maryland Department of Health, in consultation with a existing statewide steering committee on sickle cell disease to establish and implement a system of providing information on the sickle cell trait or the thalassemia trait to an individual with either trait. They added several amendments. They renamed the statewide steering committee to be the sickle cell disease, to be the statewide steering committee on sickle cell disease. And they also added, one of the charges of this group is to develop a registry, which would cover the bill, Senate Bill 859, which passed out of the Senate. But there's no amendments needed to this bill.
Okay, we've got a motion and a second. Any discussion on the motion? If not, all in favor, let's raise your hand. All right, that's unanimous. Thank you.
And the next bill is House Bill 1370. This concerns the Organ and Tissue Donation Awareness Fund. It requires that beginning on fiscal 2024, at least $500,000 must be distributed to the awareness fund to the nonprofit entity selected by the secretary to establish and maintain the donor registry. This bill actually should have been assigned to budget and tax primary, and finance would have been second, but we missed this when it came over, so it's really a budget and tax bill, but they said just, do what you want and send it over to them.
Second. All right, we've got a motion and a discussion on the motion. If not, if you're ready for the question, all in favor, please raise your hand. All right, that's unanimous.
Okay, the next bill on the list is Senate Bill 292. This is the producer responsibility bill that was described yesterday. I think Senator Augustine has a...
Thank you. I've been going around and trying to talk to, it's a bill that people need to better understand. So I've gone around and talked to some folks, and we'll continue to do so, but I just ask that we hold the bill.
Okay,
Okay.
all right.
All right, and then we're back to the two bills that were taken up yesterday. I think you know what they are. They specify the qualifications of the Secretary of Aging. And there is an amendment to the Senate bill that would conform it to the House bill by striking the requirement that this individual hold a minimum, at least of a bachelor's degree.
Okay, and we've done comparable legislation this session with regard to the Secretary of the Department of Health. All right, let's go right down the line.
David, can you repeat the last thing you said? You said we're amending it to the House bill to strike the bachelor's degree?
Yes, the House sent the bill over, and it struck the requirement that at a minimum hold a bachelor's degree, that the person who was secretary. So you have an amendment in front of you, which I didn't pass out, but it would make the bill identical and strike that same requirement. This was from the sponsor of the bill.
Okay.
So it would be, if you choose to pass the Senate bill, it would be an FWA to match the House bill.
Right, got it, thanks.
Okay, so I just want to be sure I'm clear. So you're striking that the person would need at least a bachelor's degree?
Yes, at minimum hold a bachelor's degree. You would be striking that from the requirement on the Senate bill. The House bill already has that struck.
Why wouldn't they want them to at least have a bachelor's degree? If they're going to meet all of the other criteria that were in the bill? I don't see how you would get there with less. All right. That's just a rhetorical question. Senator Kramer.
And thank you for that rhetorical question, Madam Chair. I'm not going to engage again in any depth other than to say that, yes, we did take some action with regard to our Secretary of the Department of Health, that there be certain professional standards and qualifications. In this bill, we're now taking away any of that by striking the bachelor's degree so that maybe there is some formal education, and that's fine then. And what we are then including, Madam Chair, members of the committee, is a loyalty oath to the missions of the Older Americans Act and the Department of Aging, which I'm just curious what that loyalty will be, that pledge. And then we are also incorporating that the individual have extensive experience with and knowledge of laws, legislation, and regulations relating to aging. Colleagues, what we're doing here is, once again, we've got a bill in search of a problem. The language that is part of what's required here is so ridiculously silly that it's embarrassing we're going to enshrine this in our statutes and bring this to the Senate floor. But Madam Chair, I'll be very comfortable with my position, and that's all I've got to say on it. We, at some point, we have to afford our governors the opportunity to determine who is best to fill the roles of the department heads, and whether they do or do not sign a pledge to the Older Americans Act and the Department of Aging. And we do have an executive nominations process to take a look at the candidates that the governor brings to the legislature. And if our executive nominations folks look at that and are not confident that this is the right individual, then certainly that individual will not receive the appointment. Thank you, Madam Chair and colleagues.
It does seem to me that there's nothing wrong with expecting that the person ought to be aware of the legislation, federal and state, and even local for that matter.
And Madam Chair, do you think they would not?
But let me finish saying what I think, which would bear on, the older population is one of our most rapidly growing populations. A lot of people have significant problems that are not being met, and we don't have the services that many of them need. So I think to know what the environment is that the people they are going to serve or trying to navigate makes sense, which is what I think the bill does. It just didn't seem, I was surprised that somebody would say you don't have to at least have a bachelor's degree. I'm not sure that they would be able to analyze the stuff that we're saying is left there to deal with. Yeah.
I kind of am with you a little bit, like, we had the debate on the health secretary, we were talking about, should they be a doctor or not a doctor? I mean, if you're gonna have qualifications, to strike the fact they should have a cabinet-level secretary, if we're gonna have this bill, to strike this bachelor's degree requirement, I'm trying to understand the rationale for doing that, exactly. I mean, I'd love some discussion on that, because nobody's actually offered that amendment to strike that yet. So anybody have a thought on this, striking at a minimum, hold a bachelor's degree, striking that from the
I think we could
bill?
put that back in, and I think
Well, somebody
the
would have to
rest
move
of
to
what's
take
in the
that.
bill makes sense.
Move what? Well, it's not, somebody would have to offer that amendment to the current bill, and we would
Well,
have to
that's
vote
what
on that.
she's-
Nobody's done that yet, so you don't have to do anything.
And would you like to offer that?
You don't have to do anything if you don't want to do anything. If nobody does anything, the bachelor's degree requirement will be in the bill.
Okay, then in that case, then why don't we leave it there?
So then the motion would be favorable, because there are no amendments. Well, I didn't move it, I was just telling people.
Okay, so we've moved the bill in its current posture. Do we want to hold it for further amendment?
Why? For what?
Okay,
What other amendment?
okay, okay. All righty. Okay, all in favor, please raise your hand. Okay, I'll do mine too. All right, well, that's not unanimous, so call the roll.
So Senate Bill 511 favorable. Senator Feldman.
Aye.
Aye. Senator Klausmeyer. Yes. Senator Benson.
Yes.
Yes. Senator Kramer. No. Senator Hayes. Yes. Senator Reedy. No. Senator Augustine. Yes. Senator Beidle. Yes. Senator Hershey. Yes. Senator Jennings. Yes. Madam Chair.
Yes.
Yes.
Okay, so the last bill on the list is the cross file, which I guess you would want to conform the House bill to be the Senate bill you just passed, so that would be a favorable with amendment.
Correct. Move favorable as amended.
Second.
Okay, and a discussion on this motion? If not, let's just. The same vote, it's the
Yeah.
same thing, so same vote that we just did.
Okay, and
Okay.
before you leave, you have one more thing. And this is just to verify a conversation you had a couple days ago regarding House Bill 496, Delegate Valderrama's family medical leave bill. The amendments are drafted, it's ready to go on the floor as, to be identical to Senate Bill 275. Well, we just need a formal, we missed the formal acknowledgement that you would take the same vote as that was on a concurrence. Is that the decision of the committee?
Okay,
Okay, then that's it.
okay, if everybody's satisfied, that's what we'll do. All right.